Hello and welcome to the point of the week. Today what we're going to take a look at is spleen 6. Now spleen 6 is a point I use quite frequent, particularly along with stomach 36. It's an excellent point to use, particularly for any physical therapist who's treating musculoskeletal disorders. It's going to be one of your main points you're going to utilise for tissue healing. And the same again if you're a women's health physio, again it's going to be one of your main points you're going to use for women's health issues as well, but we'll take a closer look at that. Now the location of the point, it's mainly located on the medial border of the tibia, and it's approximately 3 suns proximal to the prominence of the medial malleoli. So it's quite a tender point, particularly in women, not necessarily in men, so do bear that in mind. If you're going to actually palpate that point in women, you may well find that it may well be quite tender. It's similar to spleen 9. Women wise, that point may be quite tender, mainly because it has a strong association with women's health issues. Now again, if you are going to needle that point or even apply pressure to that point and stimulate it, then if you do have a lady that's coming in and it's their time of the month, then you do need to warn them, because it may well make their menstrual cycle that much heavier. So again, it is something that they would need to be warned about, just in case things doesn't go to plan. So as I was saying, it is something that you would need to warn them about, so do make sure that you do that. Again, besides warning them, one of the key indications for the use of this point is strengthening. It's mainly used for chronic fatigue, so again it can be utilised along with stomach 36. Also in conjunction to that, you can use some points on your REN-MAID channel, such as your REN-6 and also REN-4. So that's quite good for conditions such as your chronic fatigue, to actually tend to boost the actual patient along. It's an immune enhancing point. Also it addresses endocrine disorders. The fact it addresses endocrine disorders, that means that with regards to treating ladies who are pregnant, then you do need to be cautious. So those particular points don't want to actually be used. It's a strong point, it has a strong effect on the uterus. So during pregnancy, it's not a point that necessarily wants to be used, depending at what stage of the pregnancy they're actually at. If it's in a later stage and you're all looking to be delivering, then it's a point that can actually be utilised on that basis. It's a homeostatic point, so again it's going to be used quite effectively to treat diabetic patients. So it can enhance the diabetic aspects of things. Key things also is with regards to skin, allergies, and also skin pain, skin conditions. Very important point, along with stomach 36, that can actually be utilised. Allergies, excellent point, utilise it along with spleen 10. So those 2 points in particular will address allergies. So again, you've got your spleen 10, which is an allergy point, along with large intestine 11. That is quite good for addressing any kind of allergic reactions that may well present itself. For pelvic pain, it has a strong effect within the pelvic. And also, if you're looking at pain for childbirth, it's an analgesic point that can actually be utilised. Same again with surgical anaesthesia. It's used with one of the extra points. The extra point is a little bit higher than, well, quite a bit higher than spleen 6. It's 7 sun proximal to the prominence of the medial malleoli, where spleen 6 is only 3 sun proximal to the medial malleoli. So again, a little bit higher, but however, this extra point, these 2 points, normally you apply electroacupuncture to that point, and it mainly can be used for acupuncture anesthesia, and also it will help to treat any anxiety in patients, particularly who's undergoing any kind of pelvic operation. Now, as I was saying beforehand, it's an effective point for treating women's health, and particularly if you're going to utilise it with something such as large intestine 4, effective point for ripening the cervix. Key thing here, it will shorten the delivery time, and it will also bring the delivery date that much closer. So that has actually been demonstrated in a number of studies, to have that effect, combining those 2 points together. Same again with regards to women's health, electroacupuncture, particularly what would be a good idea, again, utilize it with the extra point. You can also stimulate it with other points, and it has been shown, that point in particular, to immediately reduce pelvic pain, particularly in women who's got menstrual pain, and it's also causing problems and discomfort, and also improves the quality of life, daily life, in that respect, and pain from day to day. So quite effective point for women's health issues. Other key areas it will actually address is the menopause. So hot flushes from menopause, also hot flushes from chemotherapy. I've used it to address a number of my patients, and I found that combine it with large intestine 11, and those 2 points in particular, once you start to look at hot flushes, very, very good, very, very effective at controlling hot flushes. So again, once you look at those 3 points, large intestine 11, stomach 36, spleen 6, studies have actually demonstrated that they will reduce hot flushes, whether it's chemo-induced or menopause-induced, and that will have an effect for up to 6 months after its application. So it's demonstrating quite effective point combination to actually utilize. Now, I've used it in painful peripheral neuropathy. One of the key things is, again, if you utilize it with stomach 36, it will address more the underlying cause of painful peripheral neuropathy. So unlike other points, if you're going to use something like the Beifeng point, the Beifeng points will actually enhance the circulation, and within the area it will also address the neurological aspect. But however, stomach 36 and spleen 6 combined, what that will have is an anti-inflammatory effect on the nerves, because you're mainly going to find the chemicals from chemotherapy and also high glucose within the blood in diabetic patients. It affects the nerves directly, and what it basically does is cause irritation and inflammation of the nerves. It affects the Schwann cells of the nerve, so compromise its ability to regrow and grow any of the myelin sheath. So on that basis, what it basically does, it reduces oxidation and free radicals in and around the nerves and reduces the inflammatory process in and around the nerves. So that's how they have their effect more directly. So therefore, those 2 points, if you are treating chemo-induced or diabetic-induced painful peripheral neuropathy, they should be in your bag of tricks or your treatment protocol, along with other points that you're actually going to target with. So do make sure that you actually combine those points, and then you're going to get a better treatment outcome. Again, it's one of the most common points you're going to utilize in anxiety and also depression. So it's quite good for treating that particular condition. You'll see many studies where it will always incorporate spleen 6. You incorporate that with other points. Main points is going to be pericardium 6, heart 7, stomach 36, spleen 6. Those points are quite good at calming and having a strong effect on the limbic system. Again, you can use the 4 gates depending on whether the patient's in a lot of pain, but those point combination does work quite well. Again, you can utilize things such as your Yin Tang 226. They are calming points, relaxing points, and also you do 20 on top of your head. Again, helps to relax the patient depending on what you're actually treating. Similar to, again, Summit 36, notice these 2 points come up quite frequently, and they should be, if you are musculoskeletal, they should be in your treatment protocol. They're going to be in most of your treatment protocol, particularly once you start looking at bone repair, tissue repair, enhancing tensile strength of tendons. They have been shown to out-accelerate any other points when it comes to bone repair, bone density. Patients with osteoporosis, that has basically demonstrated to enhance the density of the bone. So do bear that in mind, and particularly once you start talking about soft tissue injuries and closure of those wounds, then again, effective points for that. these points are used generally in diabetics. So if you've got a diabetic with an ulceration, these are where some of these points have actually been demonstrated to accelerate the closure of these particular wounds, along with applying other treatment modalities such as needling and applying the surrounded dragon technique. So again, very effective point to utilize as an acupuncture point, and then use a surrounded dragon technique as local points, and that will significantly enhance the whole treatment protocol. So as we've mentioned, they are anti-inflammatory points. It has a direct effect on the macrophages, and it's the macrophages has a strong influence on the healing process. So what it'll basically do is convert your macrophages. Normally when a macrophage migrates to an area where it's just been injured, normally as they arrive as type 1. Type 1 macrophages are pro-inflammatory. What stomach 36 and spleen 6 has been shown to do is convert it from a type 1 to a type 2. A type 2 macrophage is pro-anti-inflammatory. In other words, it's going to stop the inflammatory process and initiate the proliferative phase. In other words, it goes into the healing phase. And that's pretty much what these 2 points have been demonstrated to do. So therefore, as I said, if you've got muscle tear or any kind of injury, it has a direct effect of initiating the healing process. So very important points when it comes to the healing of wounds. One of the key things is it has been demonstrated with regards to urinary disorders, and one of the main methods in which it achieves its goal is having its effect on the tibial nerve, which then will have a neuromodulation on the sacral plexus, and that will start to affect overactive bladder. So it's going to have more, because its location, it's going to have more of a parasympathetic effect, mainly because it's out in the extremities. So therefore, quite an effective point if you've got patients with incontinence or other conditions such as that. So again, it's quite a handy point to actually use, mainly to address urinary disorders. So thank you for listening. I hope you find spleen 6 a useful point. I'm sure some of you are going to find it very useful, particularly if you're treating sports injuries or any general musculoskeletal injuries. It should be a point you should be utilising as one of your distal points. Wound don't have to necessarily be local to the area for it to have an effect. So quite important that you actually utilise those points. Hopefully you get much use out of it. If you've got any questions at all, then do please get back to me. You can get me on info@stevebailey.acupuncture.com.